welcome back to another Experts Talk. Sorry, I'm a minute late. Oh my gosh, I couldn't get the live started. I think my hand was too sweaty. Anyways, hi guys, how are you? My name's Anisha. Welcome back. Today is going to be so exciting. If you're watching this video in post, feel free just to kind of scooch forward like a minute or two. We're going to give everyone a chance to join in. Hi, and get our expert in the room, and then we will get started. Ooh, we've got a really exciting one today. I think these days are kind of tough, you know, anxiety, depression, these feelings are all stuff that we're experiencing, especially right now. So I'm really excited about today's talk. We're going to be talking about how to handle all of that when you're a mom, and yeah, just really getting nice and honest with the good goods. So let's get started. I just want to make sure everybody has a chance to get in. Once again, if you're watching this in post, please scroll forward. It's so uncomfortable that I just sit here and talk to myself. Oh, it's going to be so fun. Okay, we're just waiting for our expert to join, but let me tell you a little bit about today's talk. It's going to be so exciting. Hello. I see. We have some friends here. Okay. Hi, everybody. We are going to jump right in. Today's talk is super exciting. Remember, this is I think this is our 5th live now. So make sure you're staying tuned with all of our past talks that we've done. You can send a DM, get a PDF of all the top tips that were discussed in that talk, and leave a comment where you guys watching from. Let me know. Once again, my name is Anisha, and we are going to get this expert talk started. Okay. Guys, today's chat, I need to talk about our expert, okay? I know they are here, so I'm going to talk you up for a second so that you don't have to sit on the screen. I'm here, yay! Okay, so what you need to do is just quickly click request to join. Once you can see, you might have to scroll up to the top of the comment bar and just click request to join so that we can get you up on the chat. But in the meantime, while we get that sorted, today's expert is best known, I gotta read this whole thing, it's incredible. Best known for her work as a relationship, family, emotional well-being, and mental health wellness contributor in the media, and frequently shares her expertise and advice all over to so many people. I don't want to say it yet. You almost got me there. Our special expert is a best-selling author of numerous books and the go-to expert on a variety of important psychological issues. She also serves as a medical expert for the positions of human rights. Oh my gosh. She's also the host of podcasts, you guys. Personology. I want to make sure I say this right. I'm going to double check. Personology and How Can I Help from iHeartRadio. So exciting. She's also the mother of 3, of course. Please welcome our very special guest. We got to get you up here, Dr. Gail Saltz. Hang on. See if we can get you up here. I know it's so anticlimactic. We're gonna just keep the jazz hands. There we go! Yay! Hello. Thank you so much for joining us.
Hey, thanks for having me today.
I'm so excited. First of all, did I pronounce your name right?
You did.
Dr. Gail Saltz. Amazing. What a hardcore name. Hey, that has so much power to it. I love it. What a great name.
Thank you.
Thank you so much for being here. I'm so excited to talk about these subjects with you. And I just want to jump right in. I want to hear, why did you choose psychology? How did you end up on this path?
Oh, gosh. Well, actually, I was doing my residency in internal medicine. That was my original path. And once a week, we would have these rounds with a psychiatrist where we would talk with the patients about really their life narrative and what was on their mind, and how really a better understanding of how their mind was affecting their body and their body was affecting their mind. And ultimately, that was much more fascinating to me. So I made a decision to make a hard right and become a psychiatrist. And I have not looked back. To me, the brain is the most fascinating organ in the body, without a doubt, the most important organ in the body. And we still have many mysteries to solve. I just really, enjoy the work.
Oh, wow. That's so beautiful. I have to say, I'm very passionate about mental health myself. So just want to take this opportunity to thank you for the work that you do. And I think it's really inspiring how much work goes into it. Just a little fangirl moment, but
I want to talk about some really important things that a lot of parents struggle with. And one of the biggest ones is specifically for mothers, postpartum anxiety. That's something especially that's really difficult nowadays, pandemic, those who are raising a baby without any social interaction, totally on their own.
Absolutely.
Let's talk a little bit about this. How do you recognize the signs? When should you ask for help? Those sorts of things.
Absolutely. Well, postpartum anxiety is obviously much less spoken about than postpartum depression, right? We've been speaking about at first. My first appearance on the Today Show many, many, many moons ago was a case of a woman where there was a tragedy regarding her children and clearly mental illness and really postpartum psychosis or postpartum depression. And so I know for decades, many of us have been speaking about postpartum depression. So I think most women are aware that many women have baby blues meaning some sort of mood problem, any kind of mood problem, to be honest. It's often just lability, like I'm up, I'm down, I'm teary, I don't know why. But it really is limited to 10 days or 2 weeks, and it doesn't completely undo them, really. It's not pleasant, but it's very common. But then some women are struggling much more than that in the early stage, or it doesn't even develop till later. And it lasts for a much longer time. And that could be what they've been hearing about, which is postpartum depression, which is sadness or numbness or being teary, such that it really interferes with their ability to function and any pleasure in being, in mothering at all. And they go, maybe I'm having postpartum depression, or somebody else notices maybe they're having postpartum depression. But as you're bringing up, postpartum anxiety is actually at least as common as postpartum depression. In fact, 10 to 15% of mothers will have postpartum anxiety. So 1 in 10, 2 in 10, that's a lot.
Yeah.
And in addition, many women who have postpartum depression will also have postpartum anxiety. And what defines it as different is that it has much more to do with worry, like any anxiety disorder. Right. And of course, all new moms worry. I don't want to freak anyone out there who is just had a baby and is worrying and thinking they have this. No, all of us worry. And worry is normal. But when you're worrying a good bit of the day, every day, and you can't get it out of your mind, and some of the worries are, I'll say, irrational, as in you took the child to the pediatrician said, everything looks good, and you can't stop worrying that everything's not good, that actually they're not developing okay. You are worrying they're going to stop breathing in the middle of the night. You've got to check the monitor all night long because you can't get the idea out of your head that the child might stop breathing. That these worry thoughts are sticky. They stick in your mind. You can't get them out. Some of them you even kind of know are irrational, but they're ever present. And you might have physical symptoms along with that. Those could range from a feeling of jitteriness or agitation, like you're just pacing, you just feel like really jittery, basically. You might have nausea, sweating, feeling like you're having hot flashes. It could interrupt your sleep. And even though you're exhausted, because almost all new moms are exhausted.
No kidding.
You can't go to sleep. It might interfere with your appetite. It might interfere with your ability to concentrate or think about just about anything else. And at that point, I think it's fair to say, if it's in anywhere from birth or even actually pre-birth, to be honest, it could be like during the pregnancy.
Wow, you start getting these fears.
Yeah, up until any time, really up until a year after birth. So some women are like, I was fine for 6 months, but something happened and it set off. And now I have all of these feelings. That is still postpartum anxiety.
Right. So that definition really happens sort of anytime, I have a baby in me, to about a year. You want to be cautious of that period.
Year post-delivery, exactly. And there are some people who are more likely to develop postpartum anxiety. It could be anybody. So I don't want to say if you don't have any of these that it couldn't happen to you, because it can. But I would say that if you have had an anxiety disorder in the past, if you've had a struggle with anxiety, or you've had a struggle with depression in the past, or you're a person who premenstrually or menstrually would get some anxiety symptoms or some mood symptoms. And that, some people are more sensitive to the hormone fluctuations that are occurring. And, you have to recognize that in birth, right? During pregnancy, your estrogen, progesterone levels increase from 10 times their usual to 100 times their usual. And then you give birth and they plummet back to, an original time. So those huge shifts in hormones can absolutely precipitate for some women a mood or an anxiety problem. If you have had a past miscarriage or a past stillbirth, then for some women, that puts them at somewhat elevated risk for postpartum anxiety, as in they can start to really worry that something bad could happen because something bad happened in the past. Yeah. So there are certain groups where, you would want to be more alert to symptoms that might be evolving. Right. But it can happen to any woman, really.
Wow. Very interesting. And something I think a lot of people should be aware of. Specifically, I brought up postpartum anxiety first for the reasons you said. It's not talked about as much. And it's equally as common, which is really interesting to me. I actually didn't know that it was just as common. And something I just want to clarify for everybody here, just to make sure, you're saying that when you start to have these baby blues and these feelings, it's okay. It's when it starts to progress to this frequency of all the time, it starts to affect your functions, your daily life. That's when you should seek out help.
Absolutely. And by the way, let me just add, it's okay to seek out help before then.
We all need help, always.
If you are moving in a direction that really, doesn't feel right, then, you need to alert someone and get some support. So in the mild form, that support could be in the form of things that you do for yourself and others in your life help you to do. So that could be some offloading of baby time, with a partner or with other family members so that you can do things for yourself that will help with your anxiety level. For example, we know that aerobic exercise for 30 minutes several times a week decreases anxiety and boosts mood. So that actually could be a very good thing to do in an early stage for a mom who's looking to reduce her anxiety level, reduce her stress, and have somebody take the baby so she has some time to do that. There are other things that you could take time and do for yourself that definitely we know from studies help with anxiety. Those range from the practice of mindfulness and meditation to something like progressive muscle relaxation, which takes 5 minutes. You could do with the baby there. It's tightening all your muscle groups to a count of 5 and releasing them, moving from the feet all the way up the body to the head. Paced deep breathing, which is a form, again, something you can learn literally online and do in 5 minutes a couple of times a day to reduce your anxiety level, which has to do with breathing in, deep abdominal breathing to a certain count, and then exhaling to a certain count. And frankly, talking with others in your life to get some support. Like
everybody
I'm having
needs
a hard
vent.
time, and hearing that other people understand that and getting some support, spending some time with other people who, other moms who are understanding. Those things will help you, absolutely. But talking with a professional, of course, if you've moved on to sort of like this is starting to really interfere with life for you and rob you of the joy of motherhood, by the way, which is not joyful all the time. There's no, I don't want to, no,
I have that on my list
all the time, right? But if you're having no joy, that's a different story. And then you do want to be, now it could be just psychotherapy. It could be, and I would recommend if it's anxiety that you seek out a psychologist or psychiatrist who teaches cognitive behavioral psychotherapy that can help you question. Basically, it's questioning of irrational anxieties and giving you new cognitions or thoughts that are more in line with a rational. We're not trying to deny reality. We're trying to help you to have realistic thoughts and change thought patterns and therefore behavior. So someone like that can be really helpful. And many people do well. It's time limited. I'm not telling people, hey, you're going to go in and spend your life in therapy talking about like the origins of your childhood.
Right.
I'm really talking about like addressing this problem. Many people do well with like 8 to 10 sessions.
Oh, amazing.
And some people will, if they're in a more severe state, will need medication.
Yeah. Yeah. And I don't think that's anything to fear. You know, medication is so taboo, but gosh, it's like you said with the hormones and stuff too, there are actual imbalances and things that need to be fixed. So I love that you made sure to mention that.
These are what people need to understand. These are biological illnesses, just like any other biological illness.
Right.
There are shifts in neurochemicals in your brain that occur when you are having an anxiety disorder of any sort. But they are often hormone driven when you're postpartum. And they sometimes require a chemical intervention because they are a chemical problem. Now, it so happens that psychotherapies also attack the chemicals in your brain, and they also change brain wiring and chemicals in your brain. So it's what we call a top-down approach. It's talking to your frontal lobe, which makes changes and helps deeper brain structure. Medication is a bottom-up approach. It attacks deeper brain structure, and that helps you with your frontal cortex with thoughts that are in the more outer brain, let's say.
Yes.
So these are just two different approaches, and sometimes people just need medication because they're in a state that they can't learn the psychotherapy because they're so... If you are so overcome by anxiety, your capacity to learn something new can be impaired. Yeah. So medication can help you participate in the therapy with the idea that then you will go off it at some point.
Yes, of course. Yeah, that's a really good point to bring up. You know, therapy sometimes isn't that easy. And yeah, sometimes we do need additional help. I'm curious to know your thoughts on like a length. A common question basically I got was, how long does it last? And I think anybody who's experienced depression knows that you're in that spot or anxiety and you're like, when will this be over? Is there any insight you can give?
Absolutely. Unfortunately, if you're truly having a postpartum anxiety disorder or a postpartum, it may not resolve without treatment. In other words, it really... Oh, I'm still there? I'm still here?
Yeah, sorry about that.
Okay.
I cut you out for a second. There we go.
Okay, no worries. It doesn't have an end time. There is not a length of time that it can last, meaning it could just keep going, and it could set you up for, many years of a mental health problem. So I wish that I could say, after 2 months, it just sort of dissipates. That's not the case.
Right.
It could, if you have a mild situation and you do a lot of self-care, it's possible. But once you've moved into more moderate to severe postpartum anxiety disorder, you really must seek treatment because it might not go away on its own. It really often doesn't go away on its own. It just lasts. And the other reason it's really important to do that is because of something in the brain called the kinetic effect, which basically is when we have wiring connections in the brain that aren't used very much, they're weak. They're like what I would call a country road. Like they aren't traveled that much and they're sort of weak. And when it comes to a mental health issue, that's good because it makes it much less likely that they'll be traveled again. But when you stay ill, basically, then activity is going on in that wiring over and over and over again. And that's what builds neuronal strength. So what was a country road becomes a superhighway.
Yeah.
And that the kinetic effect tells us that once you've been ill and you stay ill, the longer you stay ill, the more likely you are to relapse again in the future.
Right.
So that makes it really important to get treatment as early as possible. The earlier you intervene, the more likely you will resolve, actually, the quicker the treatment usually, and the less likely you are to relapse in the future.
Amazing. Well, it's really good to know. Wow, so much insight. I feel like I want to take notes. Make sure you guys are sending us DMs so you can get a PDF of all these tips, because these are some incredible, incredible tips. I'm curious to know your thoughts on sort of the differences between postpartum anxiety versus postpartum depression. Is there anything people should be aware of? Can they coexist? How does that relationship sort of play out for people?
Absolutely. So basically all of the above. Postpartum depression can be its own mental health problem. The symptoms of postpartum depression, as opposed to postpartum anxiety, tend to be more either that you're feeling hopeless, helpless, guilty, irritable, down. You could be down and agitated, which can make it a little confusing with anxiety, because the agitation can feel like anxiety, but it's an agitation that has like guilt attached to it, or negativity, or, as I said, highly irritable.
Right.
Or alternatively, with postpartum depression, you could feel numb, like you feel nothing.
Right.
And like a weird,
very common
thing. And so those are the sort of two constellations of symptoms I would say happen in postpartum depression. You can have both. Somewhere around a third of people that have postpartum depression will also have postpartum anxiety. That's not surprising, because generally speaking, in the non-postpartum world, in just people having depression and people having anxiety, they often do overlap. And in fact, if you're depressed long enough, if you're anxious long enough, if you have an anxiety disorder long enough, it's not unusual if it's untreated to develop a depression. So these things often come together, particularly for women who, by the way, develop clinical depression and clinical anxiety twice as often as men. So it is predominantly female. And in postpartum depression and postpartum anxiety, it's not so important to delineate, this is one or the other. Once you know you have one of these things going on, you should seek treatment. A clinician will be able to help you gear your treatment toward, whichever is going on. But there are a couple of additional reasons with postpartum depression that it's super important to get treatment. Again, it doesn't resolve often on its own. It does compromise, as does postpartum anxiety, your ability to care for yourself and care for your infant. So, what's so crucial in those early months of mothering is the bond that you form with your baby. And if you're feeling severely depressed and are either, so hopeless and down that you sort of emotionally can't connect with others, or numb, then your ability to connect with your baby can be, decreased. And so it's really important for you and your baby that you get treatment. And it's also, at its most severe end, which most women don't have, but at its most severe end, it can be dangerous. It can be dangerous to the life of the mother and to the life of the baby in terms of care, but also, about 10% of women with postpartum depression can really have active suicidal ideation and really have thoughts of harming themselves or even harming their infant. These are, of course, irrational thoughts, but they are part of the illness. And so I say not only to women out there who think they may be becoming depressed, but I say to people who are family members or friends of people, if you see the mom getting really depressed, help her to get treatment. Bring her to somebody. Help her make an appointment for her, because, you can be saving a life.
Yeah, absolutely. With that being said, is there any specific signs that partners, families, close friends can watch out for?
Absolutely. So, you expect a woman to be tired. But if she has difficulty sleeping, even though she's tired, can't get to sleep. If she has a change in appetite, often a loss of appetite, which is really, again, dangerous. Women, if you're nursing, you need calories.
Of course. Yes.
If you're not eating properly, that isn't safe for you. It isn't good for your baby. So change in appetite. If she has what's called anhedonia, the inability to take pleasure in anything. So things that previously would have brought her pleasure watching a movie, reading, talking with somebody in particular, having a nice meal, whatever it is, and there's just no pleasure there. I have one too.
My dog didn't like that one.
No worries. My dog probably wouldn't either, but she's not here right now, luckily.
Excuse you.
I know.
Sorry.
Yeah. So anhedonia, of course, any expressions of like, why am I here? What's the point? I wish I wouldn't wake up tomorrow. That we call that passive suicidal ideation. And expressions of feelings of sadness and hopelessness or guilt. I'm not doing this right. I'm not a good enough mother. My baby deserves better. Just expressing guilty feelings or being incredibly irritable, like snapping at everything. Now, look, it's pretty normal to have more irritability in those early postpartum times because you're pretty highly stressed, and you're like a little bit of every last nerve is a little frayed. So it is normal to have some more irritability, but really high irritability would be a tip off. And this is where it's reasonable to just compassionately say, I see that you're really having a hard time, and because I care about you, and I'm concerned that you're really down, or you're really not yourself, and postpartum, that's not unusual, and I really want to help you to get help. Let me help you.
Yeah. Wow, that's really great tips, really important things to look out for. I noticed one thing that a lot of people mention is isolation is something that people gravitate towards. I myself, that's what I do in low states as well. And how can you try to recognize the difference between when they're isolating and pulling away and just needing alone time? How do you see that difference?
Right. Well, I'm so glad you brought that up because yes, that is another hallmark, social isolation. So really what it is it's a big change. It's a bit, this person. And of course, there is going to be some more like me and baby time than there was before baby was born. But if they really won't get on the phone, won't talk to, won't even connect in ways that really are not asking a big ask of their time. If you, crowbar them out of it and they're just quiet and sad and you see that they're sort of withdrawn, those kinds of, so, in mental health, almost all things except psychotic disorders are really a matter of degree, right? They're normal behaviors. They're just way out on the continuum, like 2 standard deviations off the continuum.
Right.
So obviously a person who was always more introverted and always needed time alone to recharge and now has a baby, is one way. But that doesn't mean that person always was alone and socially isolated, and they should still have some ability and need. So if they really drop off completely, you still know, okay, this is a standard deviation off of where they were. And, you probably need to push a little more than you did before, as opposed to just, hey, would you like to? Hey, really, I would like to, please, and to try to encourage them because it's helpful to them to socially connect with you. It is helpful to them. And they might not. So one thing that's really hard about postpartum depression in particular is in depression and clinical depression in general. One of the first things to go is judgment and self-observation. So that person's ability to spy in themselves something is really wrong, may be impaired. So that's why it's so important that you around that person can say, I see this, and you might not recognize this, but I do see this, and let me help you.
I really like that. It seems like a common theme is awareness, a lot of awareness as, looking into yourself as best as you can and being aware of that and being aware of your partner and how they're feeling. Wow, just such great advice. Oh, so profound. I feel like I'm being seen and possibly realizing some things, and how to learn and how to grow and evolve. I love that.
You know what? When you know something too, when you like, we're talking about psychoeducation, but like when you know in advance, it isn't so. I mean, I remember after my first baby, I definitely had like baby blues. I guess I would say it didn't evolve into a clinical, depression or anxiety disorder. But I remember like, my husband coming home from work. I was on maternity leave because it was the first 2 weeks. And like, I was still in my nightgown. It was like 6 p.m. and I had a baby hanging off my breast, and I was like stirring some spaghetti sauce, and I was like, "Is this too salty?" And he tasted it. And he goes, "Oh, maybe a little bit." And I was like, "Oh God!" And I was like, "What is happening? Who am I? What is happening?" And just if I know, like just knowing, being forewarned, I think, today many OBGYNs will give you a heads up, like this could be happening. They should. And they should give you the parameters by which, if this is happening, on the other hand, please reach out and I will help you get care. But in those days, there wasn't a lot of talk about what might go on or anything. And it felt like an alien invaded your body and, what was happening. And that made it that much scarier and that much worse to have those feelings. So it can compound. But when you know what's happening and it's not so unusual and you have some direction of what to do, it's not as frightening, for sure.
I really love that. I think that's a beautiful way of looking at it. Education to prep ourselves and then just not be afraid, because it's normal, and we're also not alone too, which I think is really important to remember. Wow, just so incredible. I know you can't stay too long, so I won't keep you. I always ask the top tip question at the end, but I feel like you've given me so many incredible tips. I actually want to ask you a different question. I want to ask you what you would say to a mother right now who could be listening, who's totally afraid, totally scared, and just like, what would you say to them?
First I'd say, depending on where you are in things, this could be like, this is the way it is when you have such a huge developmental change. And it is, because it's not just that you had a baby, it's becoming a parent, which is a big, big developmental change. And it takes some time to adjust to that and like have some empathy for yourself that that's okay and it's normal. And pretty much all new moms feel that way. But I would also say that if you are getting thoughts stuck in your head, and, we all have, every mom has a thought like, what if someone steals my baby? What if I drop my baby? What if that what if thought that something terrible could happen? That's actually normal. It's really normal. But if the thought gets stuck there and it goes around and around and around and you can't get rid of it, then I say, okay, that's impairing your ability to have joy and function and feel good and make this transition. And some help and guidance, professional help, would help you to make the most of this transition. Like it's 2021, like we got to be over the stigma already. We just got to be over it. And telemedicine is available now. You can be in your home nursing your baby and talk to a professional.
So true. Yeah.
So reach out.
Such a great way to end it. Oh my gosh, Dr. Gail Saltz, thank you so much for
Thank you for
here.
having me. Thank you for listening, and thanks all of you for being interested. It's a timely, important topic.
Yes, very important. Everyone can find you. I know you host some podcasts. Do you want just a quick second, let everybody know where they can find you?
I would say if they have a question for me, they can tweet me at Dr. Gail Saltz, or they can send me a question, which I'll answer on my podcast at How Can I Help? Well, actually, it's at How Can I Help at SenecaWomen.com, which is the women's leadership organization that I also partner with for this podcast. So I take your questions and I answer them, and you can listen to them, and it's on iHeart.
Wow, that is so incredible. We will make sure to put all of that info as well on the post so everyone can find you. Thank you again for hanging out.
Thanks so
with
much
me
for
today.
having me.
Such a blast. We will see you all in the next one. Thanks again.
Have a great day.
Bye, everyone.